You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is an expert on the topic, Dr. Kwon. Dr. Kwon, welcome to the program.
Nice to meet you, Randy. Good to be here.
Now, before we get into today's topic, tell me a little bit about your practice. What kind of patients do you see?
My practice is a dental practice, but more specifically, implant practice.
Dental implants.
Dental implants.
Now, something interesting, I guess the way it's normally done, especially here in the U.S., is you go to one person, one doctor to the general dentist to look at your teeth.
Yes.
Then you go to the surgeon that places the implant. Then you go back to the other. Then you go somewhere else for an imaging center.
Yeah.
And now in your case, it's all done by you. Is that correct?
Yes.
And that's unusual in Canada as well?
It still is, but I believe that is a better model. That's the model of the future. Because a lot of dentists, a lot of patients, they don't like to go to different places.
Well, people don't like to go to the dentist, I guess, to begin with, right?
To begin with.
Do you hear that still?
Yes.
I don't like the dentist.
It's a lonely profession, okay? So my concept was if we can have a dedicated center where they can come, get the initial diagnosis done, get their CT scan done, and have a proper consultation and presentation done, and have a surgery done, and the prosthetic done all in one setting. I think that would be the ideal. And patients really do appreciate it.
Now, this term, this advertisement, which I'm very skeptical of, and I told you this, teeth in a day or tooth in a day, that you could have no teeth, get teeth in one day, and eat.
Yes.
And that's true. You can do that now. And why could you do it now and you couldn't do it 10 years ago?
A lot of things has changed in just, even though implant dentistry has been around more than 40 years around, the real big step, big quantum leap has happened during the probably past decade. What has happened is not only the implant system itself improved drastically, the shapes, the surfaces, that helps for the bone to grow around the implant, but also the surgical technique of the surgeons has improved quite a lot as well. And on top of that, with the CT scan technology that's available so readily to us, that gives us the area that we'll be working on even before we raise any type of opening. It
seems very painful, though, the process. Is that the number one fear?
Initially, when the patient comes, that's one of the first things they ask. How long it's going to take? Is it going to be painful?
Is it? I mean, do they complain about it?
I mean, it's no more than taking a simple tooth out.
Okay.
Is it going to be a little bit uncomfortable for about a day? Maybe. But do a lot of my patients take pain medication after a simple, single tooth implant procedure? Hardly.
What are the different categories of dental implant patients, if you had to categorize them, that you see?
If we had to categorize them, I mean, from as simple as one front tooth missing to a couple of back tooth missing, all the way to having to wear denture but wants to have a fixed bridge once again, like a natural teeth that they don't have to remove. And there are those that's been to a dentist many times, and many times they've been told that their teeth have to go because it's got too much decay, too much gum problem, but they don't want to take it out.
Really?
Yeah.
There are a lot of people like that.
Yeah, they put it off for many, many years.
Interesting.
Yeah, because they don't like the idea that they have to lose their teeth and wear this dreadful dentures, and they don't want to associate with that. And those patients, they can come, and then we can do this wonderful service in one day.
So what is it, the fear? I mean, there's a lot of people, I guess, that are, they've been told their teeth have to go, and it's their fear of the dentist or the fear of the procedure. What's your take on it?
I think it can be many different things, but I think that their main fear is that having to lose their teeth is emotional.
Okay.
And I start to recognize that more and more. There's more than just losing their function when they lose their teeth. It's more psychological, emotional, the fact that, they come to a point that they have to give their self-esteem. They're not going to be the same person anymore.
Yeah.
Having to take their teeth out just like their parents did, many, many years ago. Just not wanting to associate with that.
Is this one of those things that when you give them their teeth back with the implant, where they say, geez, I should have done this years ago?
Absolutely, absolutely, Randy. I mean, when we first do these full mouth rehab with dental implant, teeth in a day, initially as a doctor, as a surgeon, I was excited because we're giving them function back. You know, these are the miserable people with afraid with their teeth just so running away and suffering for all these years, or patients that's been lost their teeth for 30, 40 years ago wearing this awful denture. Initially in our mind it's like, wow, it'd be great if you can give them this in one day without bone grafting, without hip grafting. Able to give them beautiful teeth in the same day. That'd be great.
They could chew just like the way they used to.
Absolutely. Getting their life back again.
I like something you said. You told me in the green room. You said when you ask them why they're there, and they'll say, "I'm here because I want dental implants." You say, "No, you're not."
Absolutely.
Expand on that.
Yeah, they're not here for a dental implant. I mean, patients will come and say, "I asked them, why are you here, sir?" Or "Why here, ma'am?" They say, "I'm here for dental implants." I said, "Well, no, you're not." "Well, yes, I am." "No, you're here because you want teeth." That's what they're coming for. And it's more than just teeth. They're coming here because they want to regain their self-esteem, their self-confidence. They want to regain their authority. Okay, it is more than just teeth.
So you change. I mean, you see changes in people. I mean, you give them their teeth back, and all of a sudden they act differently.
Oh, absolutely, absolutely. And it's something like I said. It was we didn't know what kind of effect it will have. Initially, like I said, it was more of a function we're after. But you see them come, they look younger. They change their hairstyle again. They change their glasses. It's just more than that. And when we
start smiling more.
They start smiling more, and it is really wonderful to see.
So people probably perceive them differently. People, especially people hiding their smile.
Absolutely. And biggest difference that dental implant makes is to the patient, how they perceive themselves.
So more confidence.
Absolutely.
Interesting. Okay, let's talk about, you talked about the different categories. One tooth. Why a dental implant over traditional dentistry? What does traditional dentistry do, I should say, and why a dental implant?
For example, let's talk about common things happen commonly. Let's say front tooth or a back molar, a tooth has to go. It could be a root canal that's broken down, a tooth that's cracked, or bad gum disease. Traditional, what we used to do, very common, and it's being practiced still nowadays as well, is by grinding the two teeth adjacent to it and put crowns on them and then put the fake tooth in between. We call it bridge work commonly.
Is that the standard right now, standard of care? That's what you do?
It used to be a standard of care and still is a very common practice among general practitioner.
Okay.
But the problem with that is, couple thing is, you got to, you got to shave down the adjacent teeth.
So damage those two
damage those teeth. And once you put the bridge on there, and over time, 5 to 6, 7 years later, food gets under there, it's difficult to clean, so you get advanced gum disease or you get advanced cavity happening, so you end up losing more teeth down the road. So, it's not a problem solving.
So just get a dental implant, put it in there.
Yeah.
That's over.
And
get your tooth back.
For many times. This way, not only...
Is it less expensive then in the long run to just get a dental implant in there?
I believe so. Initial cost might be a little bit higher, but not that much. The cost of dental implant has come down considerably over the past 5, 6 years. It's more readily financially available. And more importantly, though, in the long run, 5, 10, 15 years later, dental implant has proven that it's going to outlast most of the other restorative product. That we do.
Now, people missing 3 and 4 teeth.
Yes.
Why do they need to do something about it? You say it's very important they do something now rather than later. Why?
There's this term that we use, all saying, either you use it or you lose it. Okay. Just like a strong tennis player, they retire, their arm's going to shrink. Same as the rugby players. Same with the teeth as well. The bone around the teeth are only there because they have a function. They have to hold the root of the tooth. Okay. However, if you take the teeth out, lose their teeth out, then what happens over the years is you'll lose a significant amount of the bone.
So the bone, what, dissolves away?
It does. It
just because there's no pressure from
there's no stimulation from the teeth.
Interesting.
Yeah.
Okay.
And of course we can still place.
So is a snowball? I mean, is that where tooth loss begins?
One can lead to 3, and 3 can lead to partial denture. Partial denture can lead to more tooth loss, and later.
Is there science behind this? What you're saying?
I mean, I believe so, but clinically, in my practice, I've seen them.
Okay.
That's what happens, and majority of the dental implant patient that walk into my practice has been because of the old dentistry, gone bad, or gum disease happening, or cavity happening, or below the bridge work. I mean, I'm not saying that bridge work is bad. There are indications for that. However, for
Ideally, though, always get a
ideally.
dental implant. I mean, if you had a choice between the two, you would always go a dental implant.
For the most part, yes now.
Okay, good. Now, denture wears. You say that the denture wear benefits the most.
Yes.
How so?
Because I believe that denture wearers, they suffer the most. You know, in the past, the problem has been we wanted to help denture wearers because they couldn't eat properly. They cannot eat what they want. They'll eat what they can. And a lot of the freedom that you and I have, they didn't really have that. So we knew that deep inside our heart that we have to find a way to give them dental implant, to give them a fixed teeth. Fixed meaning don't have to take it out, meaning they can function again like they used to be. But the difficulty was not enough bone because when they've lost their teeth for over 10, 15, 20 years, bone resorbs away, just like we mentioned. And we need bone to place the implant.